This is my community analysis of Seminole, Florida. The city of Seminole was founded in the 1840s by the Mears brothers and their family. His family settled on what is now known as Seminole City Park, one of Seminole's largest and most popular parks. It was not until 1970 that Seminole became an official city, where the 895 current residents voted and decided for it to become incorporated. Seminole is 5.6 square miles large and is located on the west coast of Florida. Today, Seminole has a population of over 18,000 and is the smallest municipal in Pinellas County. There are currently over 10,000 housing units ranging from single-family homes to townhomes to condos, apartments, and mobile homes. Seminole is home to multiple churches with many denominations. The streets are lined with many food options with only a short drive needed. Fast food, dine-in, and carry-out options are all readily available to members of the community. The Pinellas County transit system used is PSTA, having many routes along the major road of Seminole Boulevard. The major streets include Park Boulevard, Starkey Road, 102nd Avenue, and Seminole Boulevard. These streets are in good condition with minor repairs needed and some ongoing construction. These roads are primarily 2-lane roads but grow to 3 lanes in the more populated areas. Seminole has made many recent developments over the past 5 to 10 years. There are many options and resources for shopping, gas, food, schools, parks, churches, and anything else that you could possibly need. The pie graph to the right shows the breakdown of the population of Seminole, with the most predominant race being Caucasian. Statistics show the employment rate versus the unemployment rate is a result of Seminole consisting of mostly middle-class income. After researching the education level of Seminole, the largest percentage was high school graduate or higher, with the next highest being a bachelor's degree or higher. According to the Florida Health Department, the 3 leading causes of death are heart disease, cancer, and chronic lower respiratory disease. The amount of overweight individuals in Pinellas County is just above the number of overweight individuals in the state of Florida, as you can see on the graph to the right. Heart disease is a broad statement accompanying coronary artery disease, hypertension, stroke, and more. Heart disease accounts for 3 of 10 deaths in Florida. About half of all Americans have at least one of the risk factors for heart disease, which are high blood pressure, high cholesterol, and smoking. Within the 5.6 square miles of Seminole, there are no major hospitals, 2 assisted living facilities, 1 walk-in urgent care clinic, and 3 primary care clinics, along with many public chain pharmacies such as CVS, Publix, Walgreens, and more. To find a major hospital, you must travel the short distance to surrounding cities such as Largo, Clearwater, and St. Petersburg. The ALFs are 24-hour care facilities ranging from independent living to total care units. 3 community objectives for Pinellas County based on Healthy People 2020 are health promotion and disease prevention, healthy community and environments, and access to care. Health promotion and disease prevention. Increase behaviors that improve chronic disease health outcomes. Promote screening, education, and referral to treatment related to cancer and heart disease. Promote activities to reduce tobacco use and exposure in adults and youth. Increase protection against the spread of infectious disease. And create a process to promote health education in the community. Healthy community and environments. Increase access to nutritious and affordable foods, and support an effort for children to have access to these nutritious foods. Increase access to safe opportunities for physical activity, and promote safe ways for transportation. Access to care. Address and reduce barriers in accessing healthcare services, developing a training program for community healthcare workers, improve communication among healthcare providers, and coordination of care for consumer through data sharing. Regular physical activity has many benefits, such as controlling weight, reducing symptoms of anxiety and depression, and reducing the risk of developing health conditions such as heart disease, cancer, type 2 diabetes, high blood pressure, osteoporosis, and obesity. Seminole has many parks such as Seminole City Park, Tennis Club Park, Blossom Lake, and Waterfront Park. Tampa Bay Water Company supplies and manages all water for Pinellas County. They are routinely monitoring contaminants in the drinking water and providing public reports. There are many septic systems within Pinellas County, and they are continuously monitored and kept up to date with Florida standards. There are few recycling options in Seminole, such as curbside recycling, drop-off sites, and specific drop-off sites for household electronics and chemicals. Air quality. Air quality is measured in AQI, which is the measure of the contaminants in the air. Seminole has an AQI of 33, putting Seminole in the good category on the scale. Pinellas County has a mosquito control program that protects the community by providing treatment and prevention services, also monitoring for any diseases transmitted by mosquitoes and taking actions as needed. Overall, the environmental resources in Seminole do meet the needs of the residents. Seminole follows a council-manager plan, which is a system of government that provides the elected officials to have political leadership, and the managerial experience is provided by an appointed local government manager. The current mayor of Seminole is Leslie Waters, who has been mayor since November of 2016. The vice mayor is Roger Edelman, who has been in office since November of 2017. The rest of the board is made up of a few other council members whose time in office vary over the past few years. All information about the Seminole Council is located on the Seminole City Council website. City meetings are open to public, and residents are encouraged to attend. If unable to attend, the meeting details are located on the website for those interested. The majority of Pinellas County's community is funded by property taxes, being 22.8% of the budget. By personal research and resident interviews, I've concluded fire departments, police forces, and EMS services are satisfactory and readily available. Although Seminole has many dining options, most are fast food and considered low in nutritional value. According to analysis of the population of Pinellas County, one of the most common diseases is heart disease. A healthier option would be fresh markets or health food stores when choosing a place to dine. Although Seminole is mostly middle class, there are still those that live in poverty or below the poverty level. There are resources available such as soup kitchens and homeless shelters, but are mostly overcrowded. Due to the decrease in affordability and availability of health care, more and more members of the community are finding themselves homeless. There are many public parks in Seminole. During my windshield survey, I not only saw many families and kids playing, but unhealthy habits such as smoking in these areas. Issues that affect the community usually affect the general health of the population and should be priority. The end.